What does a respiratory therapist do? First, I'm going to tell you that you might want to look at the video that is on the HCC website specifically for respiratory care to give you some additional information. But I'm also here to tell you that we manage all aspects of the cardiopulmonary function of a patient. What does that mean? So, we deal with the lungs. To a lesser degree, we deal with heart and kidneys as well. But primarily, we deal with the lungs. So, in a hospital setting, we might be giving breathing treatments to a patient. We might be intubating a patient, meaning putting the tube down their mouth to put them on a breathing machine, which is known as a ventilator, and then we manage that ventilator. We are in charge of the airway for any and all patients at the hospital. So, for example, going back to the floor patient, you might give a breathing treatment, you might do some exercises to strengthen their lungs, you might do other exercises that will help to get secretions out of a patient's lungs. In the ICU, or the intensive care unit, is where I was talking about the ventilator. You're going to monitor ventilated patients. You may still be giving them breathing treatments through the ventilator, but you are taking care of them and working on getting them off of that ventilator as quickly as possible. Um, what else could you do at the hospital as an RT? Well, you might work in an area of what's called PFTs, or pulmonary function testing. So if you have a patient that's having issues with breathing, such as COPD, or chronic obstructive pulmonary disease, they may need to have some testing done that you could provide. And those are what are called pulmonary function testing. You may work in the sleep area at night, where you're performing sleep studies on a patient who may have issues with breathing as well at night, and the sleep study would determine whether or not they need a machine or other therapies to help them breathe better. You could also work in the NICU, or the neonatal intensive care unit, that is working with premature babies and severely ill newborns. You could also work in the PICU, or the pediatric intensive care unit. Those are older kids, older than newborns, that are having some kind of issue, possibly a chronic issue, some kind of accident, something. So you might work on those patients. You could work in a cardiac care unit on patients that are having cardiac issues but are also having pulmonary issues. You could work in home care, not necessarily in the hospital. You could go out to people's homes that have chronic diseases and need to be seen, and you would see them. There is also sales for medical device equipment. For example, the ventilator, you could work for them selling those ventilators to the hospitals. You could work in a doctor's office, like I mentioned, doing those PFDs. There are many things you could, of course, do education, like I do. I worked at a hospital for about a decade, and then I branched into teaching respiratory care. And I find it very rewarding. Some people love to teach. So there are many, many avenues. I haven't covered them all. I do suggest you look them up uh, on the internet as much as you can, but that just gives you a small idea of what RTs can do.